Hello everyone, welcome back to our session and myself Survey here. Today we are going to discuss about emergency crash cart trolley. So we are all aware about the term emergency. So what is actually emergency? It is a situation that immediately risks on the health, life, property and environment. And right now also we are facing emergencies like COVID-19, which is a pandemic disease. So we have to be always prepared for such kind of emergencies like natural disaster due to health, then any kind of RTA accident due to use of mainly contrast reactions and drugs, so that we can have an emergency team to handle such situations and provide better care facilities. So today's topic we will be discussing mainly about the emergency codes which we are using in the department. Next, codes regarding the spillage and drugs which we are using, and on the emergency crash cart trolley and what is that trolley and why it is important for our radiology department. So many of us are working in the hospital premises and we know about such kind of codes, when to apply them and what does each code means. So that is actually an internal communication between the staffs of the hospital and the area where emergency has occurred, so that we can manage the crowd, especially the patients and the patient teams in the hospital premises. So here we can see various types of courses. We will start from code red. So code red is mainly used for any kind of fire hazards. Next we have code black, we use for any kind of suspicious packets or bomb threat. Next code purple for hostages. Next we use for code white for potential behaviors of the patient. Code yellow for missing patient. Code brown for hazardous patient. Code gray for air exclusion or infrastructure loss if there is any collapse of the buildings. Code orange for external disaster. Code green for evacuation, that you have to immediately evacuate the area, and code blue for emergency purpose. And code blue is very much important for our radiology department because we are mainly dealing with the contrast agent. So I'll tell you in details how we are going to apply this code. So our first planning is to prepare a medical emergency team, and that is they are called as MET team, medical emergency team. So you have been seen in the roadsides, like you have seen the hospital symbol and it has been written like 1044 emergency. So that is the medical emergency code. We have to call in this number like 1066 if there is any kind of disaster or any kind of natural calamities or any kind of RT or accident. So immediately that response team will come and they will take the emergency steps. Even in hospital areas we have various courses in the inter-department wise, by which we can raise the code during the emergency, and then immediately the response teams comes and help us to manage the situation whatever we are facing. So it is always advised that during emergency please raise the emergency codes, because all the team members of the emergency are well trained about the handling situation of the emergency. So don't try to attempt the situation by yourself. Seek help from the emergency team always. So mainly in this topic we will discuss about the three courses, like code red which is for fire, code blue which is for emergencies, and we are using another code, that is code orange, for any kind of hazardous spill. So first of all is, if there is any fire in your department, the first thing you have to do is you have to follow the race protocol. So what is a race? Rescue the individual from the area. Immediately you will press the emergency red button present in your system, then immediately you will evacuate the area via the fire exit area. And remember that first preference you will give to the patients, then the pediatric patients, staffs, then slowly you can evacuate once everything is under control. And the thing is, don't rush in your department and say there is a fire. Just raise the code, immediately the response team will understand, and slowly you can evacuate the patient from that particular area, saying that there is some emergencies, please you can exit via this way. So if you are saying fire, there will be a rush in the department and you cannot manage the situation. So please remember, code is very much important. So in case of fire you can also use the extinguisher, but it will be under the guidance of the fire team. Next is code blue, and code blue is very much useful in the areas of radiology because we are using the contrast media. So to manage the situation also we have in our department the emergency crash cart trolley. So if there is severe situations, you can alert the code blue. But when you are raising the code blue, there will be two categories, one for adult and one for pediatric. So like example, I will be raising code blue and I will press 111, that will be taken for the adult, and I will be raising code blue and I will be placing 100, that will be for pediatric, because there is different protocols for pediatric and adult purpose. And next is the, if there is any huge spillage above 2 ml, it may be radioactive substance, it may be blood spill, it may be any kind of hazardous fluid, so you have to then and then raise the hazardous code, that is orange code. And rather than that, you can have the emergency codes, like if there is any missing of the child, you can raise code pink or code violet. If there is any bone thread, you can hear the code black. And if there is any natural disasters like now we are facing is COVID-19, they will raise the code brown. So I hope now you have understood what is the importance of emergency codes in hospital areas. We also have one code, that is the assembly point, and that is the entrance area of the hospital. So if there is any kind of earthquake or any kind of disasters or any kind of loss of infrastructure, we then and then ask everyone to evacuate the hospital area and go to the main entrance of the hospital, and that is known as the assembly point. So you can see here right now various color codes are displayed here. So this is also present in our hospital department. In each and every department it is mandatory to have, because if there is any kind of situation in other department, you can see this blinking, so you can understand that there is some emergencies and you can also take preventive measures accordingly. So as in our department, as per MSDS material safety data sheet, there is a protocol to use the solutions. So each and every solutions, let it be in hand wash, any kind of alcoholic based solutions, you have to place this label. So this label, you can see various color codes are there and there is various meanings also about it. So I'll not go very much deep in that. You can see in the image, and we use this levels accordingly, and we can take preventive measures if such kind of spillage happens, and that is called as HAZMAT, hazardous material sign. So now in the main topic for the day, which is very much useful in our radiology department. It is used in cath labs, interventional areas, as well as in fluoroscopic department and CT scan department. It is kept in the area like near the scanning rooms, and it is used whenever there is emergency. And none but not, the name of this equipment is emergency crash cart trolley. Emergency, it is used in emergency. It's a crash cart, it contains all the equipments, and it's a type of trolley. You can shift it immediately from one place to another place. So what is this emergency trolley? It is nothing but a multi-drawer cabinet that is kept in imaging department or emergency departments, which is used during essential medication or emergencies in the emergency areas. And it has various names, and the main goal of emergency trolley is to provide first line of treatment before the emergency team appear, and that comprises of airway systems, respiratory arrest, cardiac arrest, overdose, contrast reaction, mainly in our radiology department, hypoglycemia and anaphylactic reaction. So whenever you are using this trolley, you have to keep in mind that the information should be passed on to the radiological technologist, and they should know the location where it is kept, and also familiar to the drawers what contains which. And also the best practice is just level the drawers. Next, it will be a part of his protocol, and he should maintain one log sheet where he will mention in the beginning of the day how he has started and what are the equipments he has used. At the end of the day, if there was any kind of critical situations, any drugs which were under expiry dates or not, anything need to be replacement or not, that things he should check it routine wisely. So you can see here, this is the image of emergency crash cart trolley. It has multiple drawers, and top also there is some external contents like to keep the external items or emergency items too. So in the external drawers, we keep the oxygen supply cylinders, we keep the defibrillator with monitor, we keep the portable ECG machines, our crash cart check sheet, and so on. But one thing you have to keep in mind is whenever you are using the wheels should be made up of rubber, so that it would prevent any kind of friction during its movement. So you can see here, this is a defibrillator. It is mainly used during the patients with cardiac arrhythmia or cardiac arrest. So keep sure that the wires and the battery whichever you are using is in proper condition. Next, these are the suction apparatus we have the stethoscope is required. Next, you require the IV tubes, oxygen cylinders, BP apparatus, tissue forceps, and this all things will be kept in the external content, not inside the dryer, so that we can utilize them immediately in the emergencies. So talking about the oxygen cylinders, we have three types: type A, type B, and type D. So type A is mainly used for OT, and type B is mainly used for general department, and type D is the bulk one. It is used in the oxygen center areas, supply center mainly. So you can have an option for A or option for B. So B will be the most preferable one. So now here you can see what are the contents we can keep in the various drawers, but always keep in mind that medication should be always kept in the topmost drawer. Rest of the things you can interchange it. So drawer 1 will contain always the medication, drawer 2 will contain the breathway and airway system equipments, drawer 3 will contain the circulation like IV supply equipments, drawer 4 will have IV solutions and its tubings, drawer 5 will have the cardiac and chest procedure equipments, and drawer 6 can also keep the special procedure trays if you don't have enough space on the external cabinet. So the main purpose of drawering is that during emergencies you can easily pick it up and you can utilize them. So always remember, when you are using the drawers, please level them with what equipments you are having, and always at least have an abundant equipment in stock. So moving to drawer number 1, it contains all the medications required during the emergency, and you can see here these are the list of drugs, their uses and how to use them. So always check their expiry dates before starting or before using them on the patient. So these are all the list of drugs you have seen which we are using during the emergency. So this is the setup for drawer 2, breathing and airway equipments. So you can have the following equipments. So first thing is, mainly you have to have the laryngoscope, you have to use or have ambo bags, you have to have the oropharyngeal airways and ET tubes, that is endotracheal tubes. So this will help you in the patients who are having any kind of respiratory attacks. So next drawer will be for the IV circulations, and that is mainly required for each and every purposes. So in that case you can have the various sizes of needles from 16 to 23. You have to keep it. Different size of syringe, butterfly needles, tourniquet, vials, whatever you require for your supply should be present in that drawer. So next we will move to drawer 4. Only the IV solutions and tubings only will be there. Means this drawer will be mainly for the IV set purpose. Next will be the drawer 5, where we are going to put equipments for cardiac and chest. Mainly the ECG leads, sterile gloves, sutures, cardiac needles, dressing kits. All these things will be there in the drawer 5. And drawer 6 will be the special procedure tray, where we can keep the extra items or stock items and essential things too. So I hope now it is clear to you what is the purpose of emergency course, emergency crash cart trolley. And finally, when you are using all the equipments, you have to discard them. So we have the color code dustbins given by BMD, that is biomedical waste department. So green is basically biohazard, means we can keep the general waste, non-infectious waste. Red bags, you are going to put all these things which are displayed on the screen. Yellow bag for infectious, cotton and anatomical waste, so you can put all the mentioned things there. White container for sharp items, so keep in mind that when you are discarding the needle, just break the needle with the help of needle cutter, which is given to the department. And blue code is mainly for the IB bottles, expiry date drugs. So while checking regularly routine basis in our emergency crash cart trolley, do assure that expiry date drugs should be thrown in the blue color bag. And more than that, we have another color code for our department specially, is the black color code, where we are going to discard all the radioactive substance. Okay, so that was all about our emergency crash cart trolley. If you have liked it, please do share, subscribe, and thank you so much. Stay tuned with us for more updates.